Hi, this is Kelsey Cooper, and I'm the host for Disabled Birth Stories podcast. I hope those in the disabled community can enjoy these stories of bringing beautiful babies into the world and the journey along the way. I hope this podcast helps you feel seen, heard, empowered, and capable, no matter your journey to being a parent. I hope those who are able-bodied would listen to empathize with and support their disabled family member, friend, acquaintance, or random stranger. Thank you for listening, and feel free to email me if you have any questions or would like to be featured on the podcast at disabledbirthstories@gmail.com. This podcast is for entertainment purposes only and is not intended as medical advice. Please consult your medical providers for all of your healthcare needs. Also, the views and opinions expressed by the guests are not necessarily the views and opinions of the host and vice versa. Thanks for joining us today. After listening to this episode, please remember to rate and review on Apple Podcasts and Spotify. Please also check the description for our social media links and the link to our merch store. This is your host, Kelsey Cooper, and I'm here with Alexa, and she's going to tell us her story today. Alexa, can you start by telling us a little bit about you and your family?
Yeah, so I'm 38 years old. I'm married to Andrew, who is a policeman. We live just outside Sydney, Australia, and we have one daughter, Penny, who's 8.5.
I know that your story is a little different than most, but we can start with just the care you were looking for and kind of your mindset going into pregnancy.
We fell pregnant a little bit more quickly than we thought we would. Took us a little bit by surprise. She was definitely something we'd been talking about for a little while. We'd been married for about 4 years at the time. We'd always wanted 2 kids. And at the time, I was working full-time. I'm a rehabilitation counsellor, so I work with people with acquired injuries and disabilities within the workplace rehabilitation space. I was managing a team of about 8 people and working long hours. And so I opted for private care with an obstetrician because the way the OB clinics and the hospital clinics work in Australia, you can end up sitting around for hours and hours at a time. So we went private just so that I could book an appointment, ring the clinic ahead of time and say, how many ahead of me, and then just drive 10 minutes from home to be able to see the doctor. We had opted to give birth in a private hospital as well. We'd been paying for private health coverage since we got married, so we had everything we needed.
Did you do any prep or classes or anything like that in preparation for the birth?
I went in, I would say, fairly unprepared. I did a little bit of reading. I listened to some podcasts. There were 4 or 5 other women that I was working with that were pregnant at the time. So there were some books and things that we all shared. And then the hospital offered a couple of classes on a weekend that we attended together.
Just go into your first visit, and how is it different from the U.S.? How far do you have to book out for pregnancies? I know that we usually do 6, 8, sometimes 10 weeks in gestation. So what does that look like in Australia?
So I went to see my GP when the home pregnancy test came up positive. So that would have been at about 5 or 6 weeks. She did another test just in the clinic, and then she referred me to the OB. They didn't want to see me until I was 10 or 11 weeks. And then they did a quick ultrasound just within the clinic just to confirm that I was still pregnant. And then they referred me on to an imaging clinic at the hospital to do the 12-week ultrasound, the 20-week, and for some blood tests and urine tests and things. And then we saw the OB roughly monthly, sort of through to about, well, we were supposed to see them through to about 36 weeks monthly and then do it a fortnightly and weekly, but things didn't quite go right.
How was your body handling pregnancy? I know that you have like I said, a different story and a different take on this. So kind of explain that a little bit.
Yeah, so I was very unwell most of the way through my pregnancy, vomiting sort of throughout the day. From about 13 weeks, I ended up in hospital for some IV fluids because I was dehydrated. I was working about 2 hours away from where we live. I was mostly working from home, but had to catch the train into an office. Asked for some flexibility around my working hours as well. I wanted to be able to drop down to 4 days a week and was told, you're not sick, you're pregnant. So we're not sure whether we can accommodate that. So I made the decision to change jobs. at 19 weeks pregnant to another organisation that was closer to home that could offer me some more flexibility. My OB was worried about my blood pressure from about that 19-week mark. She wasn't sure whether it was the stress of making the decision to change jobs halfway through a pregnancy or whether it was the beginning of something more serious. So I ended up in hospital for a couple of nights at around about that 19-week mark. And they did an early glucose tolerance test for me, the test for gestational diabetes, which I tested positive to. And they were also concerned about hypertension in pregnancy. So they started me on some blood pressure medication from about 19 weeks as well. Managed to manage the diabetes with diet for 3 or 4 weeks. Then no matter how carefully I weighed my food and counted my carbs, my blood sugars kept spiking. So I was on insulin injections 5 times a day from about 23, 24 weeks through the pregnancy. And at that point, I ended up on hospital visits twice a week. So Wednesdays and Saturdays, I'd have to go in for some monitoring, quick ultrasound, put the fetal monitors on the belly, and they were doing blood and urine checks twice weekly as well. So I was glad I changed jobs because that would have been really hard to manage with something a couple of hours away from home.
You said that you didn't make it to not quite a full term. So what kind of happened to get into the 36-week mark?
Yeah, so the job I was doing involved going out to meet people who'd returned to work after acquiring a disability or suffering a significant injury. And I would go and meet them at doctor's appointments or at their workplaces. And at 33 weeks, it was a Monday, I'd been out to somewhere about 45 minutes from where we live to go and visit a lady who'd just returned to work, and I'd organised an OB appointment on my way home. Did the meeting, everything's going okay, was feeling a little bit headachy, just not quite well, but I hadn't been feeling particularly great the whole way through my pregnancy, so thought nothing of it. By this stage, I'd been going to so many appointments. My husband wasn't coming to every single one with me. He was working, but I rang my mum, who was a teacher at the time, working not far from where the doctor's office was, and said, do you want to come along to this one with me? You might be able to see the baby on the ultrasound. She said, oh, that sounds nice. So she came and joined me there. Got into the office, they checked my blood pressure, and the doctor said, you're not going home, off you go to hospital. So I was really glad that I'd organised to have mum come with me. At that point, we thought it was all a little bit of a joke because I'd spent so much time in the hospital. The nurses there knew me on a first-name basis because we'd been in so often. We set ourselves up in the room, had a lukewarm cup of tea and waited around. And then they came in and said, we've got the results of the latest tests and you're here on bed rest from now until you deliver the baby. She was due on the 11th of January. This was the 30th of November. And so we thought, oh, we're here for Christmas, we're here for New Year's, we're in for the long haul. Messaged my boss and said, look, I think I can sort of work on bed rest. I can do some reports. If you've got any admin work you'd like me to do. He said, great, better than you doing nothing. I thought I'm going to be bored out of my mind sitting here. And then sort of settled in for what we thought would be the next 6 or 7 weeks. Within the hospital, they were coming in once every 3 hours to do blood pressure checks and all the standard kind of observation. They came in 2 or 3 days after I was admitted to hospital and gave me the steroid injections for baby's lungs because my blood pressure had continued to increase no matter what medications they gave me. It wasn't at the point yet where they were saying this is preeclampsia and we need to deliver. But at the private hospital where we were booked in, they didn't have a NICU, the neonatal intensive care unit. So they transferred us to the larger public hospital across the road. They were worried that at any stage they might need to make the decision to deliver. And they'd warned us that if we weren't sitting in the public hospital, that they might have to transfer the baby to any of the other larger public hospitals within the state if there wasn't a bed available for the baby. So we made the option to move from a very comfortable private hospital where I had my own room into the big ward in the public hospital. And I just spent all this money. Now I'm in the public hospital anyway. But, well, look, it was less than ideal. I was on the ward at 34 weeks pregnant by this time with lots of other mums, with lots of other sorts of issues with their pregnancies. There were some that were in there just for 1 or 2 nights of monitoring. There were some that were in there like me. They had me right next to the nurses' station. I was told I was the highest risk person on the ward at the time. And it was exactly 9 months after 50 Shades of Grey had been released in the cinemas. So there were many, many jokes from the nurses all night about how many 50 Shades babies were being born. It wasn't the most restful of environments. Again, they were coming in every 3 hours to monitor the blood pressure and everything. I had a reaction to the steroids they'd given me, so broke out in a very red, itchy rash all over my body. And then they just continued sort of testing, monitoring. Once I'd been in hospital for 2 weeks, again, it was a Monday morning, had the regular check with the OB doing her rounds. And she said, we've got the results of your blood tests that were done overnight. This baby's coming out today. So, like I said, my mum was working about 10 minutes from where the hospital was. So she'd been coming in to visit me on the way to and from work. My husband was working about half an hour from the hospital, and in the state where we live, the police officers do 12-hour shifts, so 6 a.m. to 6 p.m. or 6 p.m. to 6 a.m. He was on a day shift that day, so he was off at work. We weren't sure what day we'd deliver, so I'd said to him, keep working. We don't want to use up your parental leave. Save all of your holiday time for when we actually have a baby. Mum was in there with me, and they said, we're going to start prepping you. Off we go. It wasn't quite the sort of racing down the hallway thing that you see on some of the TV shows, but they were moving things pretty quickly. We were able to ring my husband's work and track him down. He was able to just make it to the hospital. We were worried that Mum would have to come in. And then we were sort of in the room and getting ready to go. They had decided when I was about 25 weeks that we would be opting for a cesarean. So I probably should have noted that earlier. Because I had hypertension and gestational diabetes, with the amount of medication they were having to give me and the risks, they'd said the safest way to go would be for a planned cesarean. But because this was at 35 weeks, they classed us as an emergency surgery. So in prep, they had me in the operating theatre. They had a midwife there to support me, but my husband and my mum were asked to wait outside. And I was hunched over the bed, holding a pillow, getting ready for them to put the spinal anaesthetic in. And as they popped the needle into my back, I said, oh, my foot hurts. They said, oh, that's weird. Let's try again. Oh, my foot really hurts. I had these burning electric shocks going down my left leg. They tried another time again. Ow, my foot really hurts. They said, well, you shouldn't feel pain in your foot. It's just pressure, but we're having a little bit of trouble. You seem to have a really small space between your vertebrae here. We might need to do a general anaesthetic. And I said, I don't really want a general anaesthetic. She's 35 weeks. I want to be awake to see my baby come into the world. Is there anything else we can try? They tried up one level in my spine. The spinal anaesthetic was successful. It was all numbed up. They brought my husband in. They delivered the baby. Wow, that was a strange experience as well, kind of being awake and alert but not able to feel something, and then all of a sudden this little person, she cried as she was taken out of me, which was wonderful. They'd been a little bit worried that she might not. They were able to pass her over to my husband. He was able to hold her for a few minutes. I got to touch her with one little finger, and they said, look, given she was a little bit early, we're going to have to take her away to go and get checked out in the NICU and just make sure she's all right. So we had elected, if she was going for some extra help, that my husband would follow her and he'd be there to make any decisions about her care, and that I would just stay with the doctors. I knew I was well taken care of. So they stitched me up. They did all the usual things. They took me out to recovery. I was there for a couple of hours, again, because they were worried my blood pressure just wasn't settling. And then a few hours later, I was taken up to the ward. She was born just after midday, and I made it back to the ward by about 3 o'clock in the afternoon. My parents, my in-laws, and I think one of my brothers had all made it to the hospital by that chance. They'd all been given the opportunity to cycle through the NICU and go and see my baby, and I had seen her with one finger. which wasn't ideal, but they were able to take lots of pictures, which they brought up to show me. 7:00 that night, they wheeled me down to the NICU and I was able to go and see her. She had had a little bit of assistance with her breathing and they'd had to put a feeding tube down her throat because they had given me some insulin just before we delivered and her blood sugar was really low. So they needed to get some formula into her really quickly. Again, because of some of the risks that had been identified in the early stages, we had consented to having some formula given to her. They hadn't wanted me to attempt to express any colostrum or anything because of how early in the pregnancy I was, and they were worried that if we did attempt to express it might have induced labour, which, happened early anyway. But I was able to hold her for a little bit, which was really nice. We were able to stay down there for about an hour, but I was really tired. I'd been woken up every 3 hours for the last 2 weeks. So we sort of settled her in for the night, went back up to the ward, and then it was probably the worst night of my life. I was in a room with another mum. She'd had a cesarean. She'd had gestational diabetes. She'd been full term and she was able to have her baby with her. So I was still numb from the spinal anaesthetic, all the raging hormones from having the baby, and then stuck in a room hearing somebody else's baby cry. She was able to pick her baby up. Couldn't see anything going on because they had the curtains separating us, but I couldn't get to my baby. I couldn't get out of bed. So I sort of lay there awake, upset for hours and hours and hours. At about 2:00 in the morning, one of the nurses came in to see me and I was just distraught. And I said, I just want to be with my baby. And they were kind enough to find someone and they took me down to NICU. And they were able to sort of stick me on the side somewhere so I could sit somewhere and look at her. Wasn't able to touch her. She was in the little crib thing and I finally fell asleep there for a couple of hours. I think somebody noticed at some stage and they took me back upstairs. And then the following morning, my husband came in. They came around to check on me and they said, well, if you can get up out of bed and you can go to the toilet, then we can pop you in a wheelchair and you can go and spend a couple of hours with baby. So, of course, that was the only thing I wanted to do. So I'd still had the catheter in place from the night before, so they popped that out. My husband and one of the nurses helped me hobble across the floor to go to the toilet. Everything was very sore. Everything was still feeling very strange. Was able to do what I needed to do, popped in the wheelchair, went downstairs, attempted to nurse, but she just wasn't latching, wasn't able to. I don't think I was producing any milk or anything at that stage, so we consented to continuing to tube feed her. We were told that babies born before 36 weeks don't have the suck-swallow reflex, so it might take her some time to learn to eat by herself. So they ended up putting a nasogastric tube in for her, and then we were feeding her formula through a syringe. Funny side note, my daughter currently thinks that all babies are fed through their noses because the same thing happened with her little cousin and got a bit confused when she saw another mum breastfeeding. Too funny. So we spent a little time with her. We were able to do things like change her nappy, give her a bit of a cuddle, and again, just hit by this massive wall of fatigue. So I asked if I could be taken back upstairs, still being transferred everywhere in a wheelchair at this stage. Went back up to the ward, did manage to have a couple of hours of sleep. I think my husband went home to go and collect some more pajamas for me or something along those lines because I was by myself and the sort of next part happened. But I woke up and thought, oh, I need the bathroom. I've done this before. There's a rail along the side. I'll just take myself. So I got most of the way to the bathroom. It was only, a few meters. I'd made it over to the bathroom. I had the pants and the huge maternity pad around my ankles doing my thing, and my legs went out from under me. So pushed the emergency call button. Bunch of nurses rushed into the room. Everyone was worried that I'd fainted. I hadn't fainted. I just lost some feeling in my legs. I couldn't stand up. They got me back to the bed and I started feeling like I had nails being driven through my left foot. There wasn't anything there. I was in bed, had no socks or shoes on. The area we live in is just outside quite a low socioeconomic area. And there have been some issues with things like drug-seeking behaviour at some of the large hospitals. And it started to feel like when we were asking for some pain relief and some help, the doctors were of the opinion that you're just wanting some morphine. Now, after sort of asking for an hour or so and saying nothing's relieving this pain, they were giving me paracetamol. Keeping in mind I'd had a cesarean less than 24 hours earlier, they gave me a dose of something that made me very sleepy and then said, just leave it. It'll probably go away. Something might have happened to your sciatic nerve. It's not really a problem. These sort of things happen all the time. Tried to get up again a few hours later to be able to transfer over to the wheelchair, and again, shooting pain up the leg, no power through my leg, was unable to stand. We were eventually able to negotiate to transfer back to the private hospital where we had our doctors that we'd selected rather than just getting whichever random doctor was available in the public hospital. Was able to speak to my OB and say, hold on, something here's not right. And within an hour, I had the head of anaesthetics from the public hospital in my room. He said, in one in about 10,000 spinal anaesthetic cesarean births, there can be issues with nerves. He said, you signed the consent form. I said, yes, I did. But it was kind of given to me. They said, you need to sign this so you can have your baby. You don't really look at it in the moment. You just kind of go, yep, I know this needs to happen, sign away. Yes, it was there. And he said, I think we might have accidentally grazed your nerve. So they sent me for some testing. We had a nerve conduction study and an MRI, and they concluded that they had lanced my spinal cord during the placing of the spinal anaesthetic, which had resulted in, at the time, they thought was temporary nerve damage. But we're 8.5 years later and I still can't move my left leg properly. I still have shooting pain that comes back from my foot. And I wear a brace from mid-thigh through to under my foot. It's a knee, ankle, foot orthosis. I walk with a stick and I use a power wheelchair if I'm going long distance. So that's where my story is a little bit different. I acquired my disability as I became a mum.
When did you realize it's not temporary, this is going to be long-term, and what did they say about that?
Yeah, so the work I do in rehabilitation, I work with a lot of people with back injuries and nerve damage, and the standard school of thought is at about 12 months post-injury, you know whether you've made some recovery or not. So I felt quite lucky that I had that level of sort of health education that I think a lot of other people wouldn't have had. So I think for the first couple of months, I was annoyed that it had happened. It was painful. It was frustrating. I was learning how to pregnant at the same time as I was learning to manage what I thought was a significant injury rather than seeing it as a disability. I spent lots of time with a physiotherapist. I saw a neurologist. I was started on a medication we call Lyrica in Australia, which was originally an epilepsy drug. It's now used to treat chronic nerve pain. Now that resulted in me gaining about 20 kilos quite quickly. It did help the pain. It got things to the point where I was able to stand and walk, but it also made me feel quite anxious and really not myself. I spent lots of time with a psychologist in the early couple of months. Again, I think I'm quite privileged working within the rehabilitation field. I recognised that things hadn't gone quite right. I was worried I was at risk of postpartum depression. So I asked for a referral to go and debrief with a counsellor quite quickly. But it became apparent to me at about the 6-month mark, when things just weren't improving, that this was probably going to have to be something I would learn to live with. I think it was about 12 months from when Penny was born that my pain specialist said, I think we're going to need to start looking for some long-term options to manage this. If it's still this painful, if you're still having these many problems at this point in time, this isn't something that's going to improve quickly.
You said you started with physio. What were their next steps in that? Were they wanting mobility aids or more therapy, or what were they suggesting?
It was more and more therapy, really. I felt a very strong push not to use mobility aids. So they kept me in the hospital for a week and a half after Penny was born, and they wouldn't discharge me until I could walk unaided. In hindsight, I don't think that was the right thing to do. My daughter's pram was my first walker. I used to go everywhere with the pram because without it, I fell over all the time. And I didn't buy a walker or a walking stick until she was too big to use a pram. I used to do crazy things like drop her off at daycare and then use the pram to walk to work rather than putting the pram back. So I would load my laptop and my work stuff into the pram and walk down the road with the walker. But there was such a strong push from them to learn to walk independently. And I think it was pride. I think it was not accepting that it was a permanent injury, not wanting to go and invest in mobility aids. And then I think the health professionals that I was working with kind of encouraging me, no, you can do this. Just keep going with the exercises and the falls will get better, but the bruises kind of told a different story.
What was it like parenting with this whole new mindset and realizing like this isn't going to get better?
It was hard. We spent so much money as well in the first 12 months after the birth, just on doctor's appointments, rehab appointments. I went back to work 4 months after Penny was born. In Australia, we have some paid maternity leaves through our social security system, Centrelink. It's a few $100s a week. It's nowhere near the same as you'd get working full time, but it's better than nothing. So I was able to use that. I wasn't working in a job where we had any paid parental leave schemes at the time. I was lucky in that Penny was born just as the schools broke up for the year. In Australia, we have our long summer break in December and January. So my mum was off work for 6 weeks just as Penny was released from hospital. She was kept in the NICU for 2 weeks after she was born. She needed to learn how to eat without the feeding tube, so they would release her. So she was released from hospital on the 21st of December, which I think was actually Mum's first day off work for the year. So luckily we had some extra hands around. We lived 20 minutes from my parents and 10 minutes from my in-laws, so we had lots of people sort of in and out of the house, doing things like dropping off nappies and formula and prepping meals and things like that. I chose not to go to any of my doctor's appointments after the birth by myself, partly because I was worried I wasn't being believed and that it was really quite upsetting to have to keep telling the story of what was happening. So I made sure I took either Mum or my husband with me to every single appointment. We opted to start paying for a cleaner because I learned quite early on that I couldn't do things like bend down to scrub the shower or the bathtub without falling into the bathtub and hurting myself. We got a bassinet on wheels that I would use to kind of push Penny around the house and move her from room to room. And I opted not to do things like carry her in a baby carrier because I was just so worried about falls. So rather than doing that, I would get the pram out of the car every time we went somewhere. I was very fortunate that it was my left leg that was affected, not my right, so I was able to continue driving. But I think without that, I would have been stuck.
Can you go over a little bit about how the healthcare system differs in Australia versus the US and what kind of you experienced?
Yeah, so within Australia, we have quite a well-funded public health system. So you can opt not to pay for very much of your healthcare at all. So you can effectively have a baby without any out-of-pocket expenses if you're choosing to go through the public hospitals. It does mean that you're sort of seen by a midwife rather than an obstetrician. You are spending time kind of waiting around at the clinics. You don't pay out of pocket to deliver in a public hospital, but you can opt to pay for private health insurance, and then you there's like a gap payment, they call it. So we spent about $3,000 delivering within a public hospital, but with our own obstetrician, and then recovering within a private hospital. But between the 2-week NICU stay, my 3 weeks in hospital, and all of the allied health care that we had, I dread to think how much we would have had to spend if it wasn't for our well-funded public health system here. Post birth and sort of at home, we do pay out of pocket for things like specialist appointments, physiotherapy, tests and things. But again, the Medicare system reimburses a reasonable proportion of those. And again, dread to think about the financial impact that we would have had if we didn't have that system in place. It does start getting really expensive when you're starting to think about wheelchairs and walkers and home modifications and all the rest of it. So once we learned that the injury was permanent, I had to gather some evidence and make sure we had a diagnosis. They'd never called the injury a spinal cord injury. They were only calling it nerve damage, grazed the nerve, lanced the nerve, using this sort of language. They called it chronic pain at one stage. I did have a spinal cord stimulator inserted when Penny was 18 months old, which really helps. A little device about the size of a pacemaker that sits just near my right hip. And there's a wire that attaches to my spinal cord, and it delivers a really low-grade electrical current that blocks the pain signals coming from my foot. That meant that I was able to stop taking all the heavy-duty medication that I was on. That was wonderful. And then through that process, we were able to get the formal diagnosis of an incomplete spinal cord injury, and I made an application to our National Disability Insurance Scheme, which provides funding for people with significant permanent disabilities. And it supports everything that the other government systems don't support. So it doesn't pay for like an income stream, but it does provide funding for walkers, leg braces. We now have a cleaner who's funded through that scheme, and my power wheelchair was funded through the NDIS as well.
You mentioned it a little bit, but can you tell us about parental leave and maternity leave in Australia?
Yeah, so our federal government provides 18 weeks at about the minimum wage, and don't ask me to quote you the amount that it is at the moment. At the time, it was about $400 a week. So nowhere near covering things like our rent or mortgage payments and everything else, but it was enough to supplement my husband's full-time income. There's been a few changes to the scheme since Penny was born, and a lot of employers are now opting to top up that parental leave. So there are many organisations now that are topping up what's provided by the government so that people are either able to take 6 months on partial pay, or they can take the 18 weeks provided by the government on sort of close-ish to a full-time salary. It's a really wonderful opportunity to be able to recover with some financial support. We opted when Penny was 18 months old. So when she was 4 months old, I went back to work 3 days a week. And then when she got to about 18 months, I was able to return to full-time work. I never managed to return to the job I was doing before she was born. I couldn't manage all of the driving and the travelling. I wasn't able to walk through the hospitals and through the workplaces and things because I was in denial and refused to get a walker. So I changed to a more administrative job.
You mentioned what you did working with people with disabilities. Can you tell us a little bit about what they do and what they would help people in Australia to accomplish through your work?
Yes, rehabilitation counsellors are specifically trained to work with people with injuries, disabilities, psychosocial factors affecting their ability to participate in employment. So I studied psychology as an undergraduate and then did a postgrad in rehabilitation counselling. Most of the work that I do these days is with people with complex disabilities, so spinal cord injuries, traumatic brain injury. I work with some deaf and blind clients, and I also work with a lot of clients with psychological injuries and disabilities. We're either helping people to modify their jobs, either temporarily or permanently, to return to their original workplace. So a lot of things like helping to advocate for our clients around workplace accommodation. Or if someone's injury means, or disability means that they're not going to be able to return to their pre-injury job, we perform vocational assessments with them. So we're looking at things like their interests, their skills, their qualifications, and then trying to match them with the best possible career options, considering whatever changes their body might be going through.
What are some resources? How would you get in contact with someone like a rehabilitation counselor?
Yeah, so within Australia, we've got a professional body called ASOC, which is the Australian Society of Rehabilitation Counsellors. I'm really proud to be a board member of ASOC now. I've been doing that for the last couple of years, and I feel that my lived experience with disability plus my work experience kind of helps me to give voice to both our clients and the practitioners. So within Australia, you can hop onto the ASOC website, you can find a rehab counsellor, and the States has a similar body. I do apologise, I should know this, but I can't remember the name of the body, but we can do a quick search and I can send that to you afterwards if you like. We could maybe pop it in the notes. In Australia, funding for rehab counsellors is provided through workers' compensation schemes, and I believe it's the same within the US. Also for veterans, so veterans discharging from the armed forces are able to access rehab counselling services to be able to help work out what they're wanting to do next with their lives. Our disability employment schemes within Australia, so again, people accessing social security, are able to access some assessments through rehabilitation counsellors through our Centrelink services. And then the National Disability Insurance Scheme, the NDIS, that I receive some funding on, also provides funding for rehab counsellors. And within that space, at the moment, we're working with a lot of kids who are sort of 15, 16, 17 years old, approaching the end of high school, starting to think about what they want to do with the rest of their lives, and doing some planning and some transition services to help them work out what their post-school options might be.
Are there any social media links or anywhere people can contact anyone?
Yeah, so LinkedIn is probably the best option for rehab counsellors, especially within Australia. ASOC is all over LinkedIn. We don't have much of a presence across Facebook and Instagram. And again, I'll send you the links through to the US sites as well, so you'll be able to include those.
Wrapping up here, what is something you've learned or something you would want others to know about your experience with your birth and what you've gone through?
I think in hindsight, I wish I'd advocated stronger for myself in the moment when they were placing the needle. They said I wasn't allowed to have a support person in the room, that I could only have the midwife that I met, 5 minutes before I went inside. I can't even remember her name. I remember she was lovely, but she didn't know me. And I think if I'd had my mum or my husband in there with me, or potentially both, which is what I'd wanted, they would have been able to say, hold on, she doesn't look okay. Something's going on. Can we stop? Can we rethink what we were doing? Whereas in the moment, I felt so vulnerable and that I just needed to sort of keep going with what they were doing. And I've always thought, if someone had been able to help me sort of speak up after they'd placed that needle for the first time, would it mean that the injury was temporary rather than permanent? But I also think we'll never know, and things are good, Disability isn't bad, it's just different. This isn't how I imagined life as a mum, but it doesn't make it any worse or any less than it could have been. It just meant that our story changed.
Where can people contact you or get in touch if they have any questions? Would you be open to that?
Yeah, so I'm on Instagram, stick it in the description. I guess professionally, I'm on LinkedIn as well, just under my name, Alexa Locke. So if you've got questions about sort of what we do as a rehab counsellor, I'm on there. I do share through my Instagram little bits and pieces about mum life with a wheelchair. We also have a beautiful service dog, a Labrador named Gem. She features quite heavily as well. So if you like cute little puppies, come and check us out.
Well, thank you so much for coming on. We really appreciate it and sharing your story. I know it's kind of unconventional based on what we do here, but I really think that it'll help a lot. So I appreciate you coming on.
Thanks so much. It was lovely speaking with you.
Thank you for listening, and feel free to email me if you have any questions or would like to be featured on the podcast at disabledbirthstories@gmail.com.